Hello, I'm Dr. Greg Gordon, and welcome to your child's 2-month checkup. There are 4 topics I want to cover today. The first is 2-month-old development. The second is sleep. The third is vaccinations, the hot topic at the 2-month visit. And the fourth is date night. 2-month-old development. By the time your child is 2 months old, they should be able to lift their head when prone, follow an object to midline, appreciate the human face, and smile. 2-month-old sleep. By 2 months, your child could be sleeping through the night. In practice, I find about 1/3 of my patients are sleeping regularly at 2 months. Continue the good habits we talked about at the 2-week checkup. A bright and stimulating day, a dark and boring night, and a regular, consistent bedtime routine. Remember, our goal is consistent 6 to 8 hour stretch at night. Well, as that's not a whole bunch of sleep by most adults' definition, it's the beginning. Once kids consistently give their parents 6 to 8 hour stretches, they usually stretch them out from there. The next step along our journey to creating a good sleeper is to space out your child's feedings. The average 2-month-old feeds every 2 to 3 hours from the start of one feeding to the start of the next feeding. By 4 months, we'd like these feedings spaced out to 3.5 to 4 hours from the start of one feeding to the next. I recommend you work on the minimum, meaning first, spend the next few days evaluating how often your child actually feeds. Suppose you find your child's feeding from 2 hours and 45 minutes to 3.5 hours. The first thing I'd do is I'd set a minimum of 3 hours between feedings, meaning you're not going to feed the child until 3 hours from the start of their last feed. Which probably means a couple times during the day, you're going to have to try and coax your child to be patient. Bouncing them, giving them a pacifier, walking inside and outside, generally cursing my name while you wait for that time to pass. Hopefully your child will be a little hungrier, not too fussy, and will learn to take a little bit more, and will gradually space out these feedings. As the 3 hour stretches get easy, and after that's kind of settled in, I then say, okay, let's try 3 hours and 15 minutes. This is a slow process. It shouldn't be forced, it shouldn't be quick, it shouldn't be miserable. It should be gradual, gentle, and persistent. 2-month vaccines. We consider ourselves to be a pro-vaccine practice. We encourage and even expect our patients to be vaccinated. We believe vaccines are important to protect individuals and our community. Vaccines are essential to protect our community's immune-suppressed, including newborns, pregnant women, people on chemotherapy, and children that have had transplants. Splitting vaccines. Parents often ask about getting less vaccines at one time. The idea of instead of getting 3 vaccines at one visit, to get 2 at one time and come back and get the other one later. And truth be known, we will tolerate it because those children are at least getting vaccinated. But there's a couple of downsides that families need to be aware of. First, most insurance companies would require a copay for each visit, so you would have an increased number of copays for each vaccinating visit. These children tend to fall behind on their vaccine schedule, and it becomes a little more difficult for we as physicians to figure out the proper timing. Fourth, there's really no known advantage of spacing out vaccinations. It may be less safe. Frankly, we don't know. We in our practice really recommend getting your vaccines along the recommended studied schedule. When I talk to families about the type of vaccines we offer in our practice, I like to group them into a couple general categories. The first group is the older vaccines. These are vaccines that our patients, grandparents, and maybe even great-grandparents had. The original diphtheria, tetanus, and pertussis vaccine came out in the 1930s. Today's vaccine has been purified and has a lot less side effects. It's still listed that it has a 3 to 5% risk of fever. However, I don't think that 1% of my patients have fever after their 2-month vaccination. Secondly is the polio vaccine, which came out in 1955. In the United States, we no longer offer the oral polio vaccine, just the safer injected polio vaccine. This vaccine is a lot like others in that there are some common side effects. All vaccines carry the risk of infection, as well as local reaction, and often you can feel a knot underneath the skin after the vaccine has gone in, even for a couple weeks. The second major type of vaccines are meningitis vaccines. We offer 2 meningitis vaccines at the 2-month checkup. The first is Hib, or Haemophilus influenza, which came out in 1985. The second is Prevnar, which protects against a bacteria called Streptococcus pneumonia, which was introduced when I was in practice in the year 2000. These vaccines have been nothing short of a huge success. Looking at old patient records, it looks like a physician in our office in the 1970s saw about 1 to 2 cases of bacterial meningitis per month. Since I've been in practice over the last 15 years, our entire practice of 10 physicians has seen only 5 to 10 cases of bacterial meningitis. It's a startling, dramatic, exciting change in our world. The last 2 vaccines I want to talk about are the hepatitis B vaccine and rotavirus vaccine. Hepatitis B, even for me when I was in medical school, was the #1 cause of liver disease and liver cancer in the United States. And again, a dramatic change. Over the last 15 to 20 years, it's really fallen off the face of the earth and is just non-existent as far as an infection that we see in our practice. Second is the rotavirus vaccine. We offer a rotavirus vaccine called Rotatech. Rotavirus is what my parents would have called the stomach flu, or at least one virus that caused stomach flu-like symptoms: vomiting, diarrhea, and fever. And rotavirus was nasty. It was a virus that kind of swept through schools, and 14 of the 17 kids in the kindergarten class would be missing one day. Rotavirus has a high risk of dehydration in small children and just misery in older children. This is a vaccine that came out in 2006, and so my older children weren't born in time to get it. Only my 3 youngest kids have had this vaccine, and we have had the cases in the Gordon house where the older kids are vomiting and the little kids are okay, and it's pretty amazing, it's pretty impressive. This is a drink vaccine, and if you decide to get it, because it is not required to go to school, it is recommended, it's something my nurse would give before they do any of the other vaccines. So we've talked about a lot of vaccines, but how do we offer them? So today, over the last couple of years, we've been offering a vaccine called Pentacell. Pentacell, penta meaning 5, protects against 5 diseases: diphtheria, tetanus, pertussis, polio, and Hib. So it's basically 3 shots in one. Second is the Prevnar, or the strep pneumonia meningitis vaccination. And third is the second hepatitis B. So we're talking about 3 shots and then a rotavirus vaccine, which is oral. So what's realistic? What could you expect as far as side effects after vaccination today? Well, there's a risk of infection. Anytime anyone pokes a needle anywhere or cuts anything, there's a risk of skin infection. To reduce that risk, my nurse will wipe off the skin with alcohol prior to the vaccinations. Fussiness. Pretty much all of our kids were fussy the day they had their vaccines, sometimes for just a few hours or sometimes for the majority of the day. Tender thighs, and all of our kids after having vaccines seem to be real irritable if you touched or squeezed their thighs. I unfortunately seem to do that with great regularity. In my effort to try and comfort the child, will often seem to squeeze them there. I don't know how I seem to do that. We talked about it earlier. There's a 3 to 5% chance of fever with the DTP vaccination. Local reaction. So all vaccines carry a risk of local redness at the site where there was medicine injected. And a knot under the skin. So often you can feel a little nodule just underneath the skin, sometimes for even a couple weeks after vaccination. These do eventually go away and don't cause any problem for the children. It is time for you and your spouse to go on a date. Take a break, get a babysitter, ask your mother to come watch your child. A couple rules for the date. No movies, you guys need to spend some time talking. No groups, this is not intended to be a big party. This is some time for you guys to connect as spouses. And put your phone away. Stop texting your friends, stop taking pictures, stop answering emails. This is time for you and your spouse to connect. And that'll about do it for your 2-month checkup. If you have any further questions, please feel free to see my website, GregoryGordonMD.com.